Welcome everyone to Chat GBP. It's good to see you again. We're talking about mental health today. Obviously, it's focused around men's health and it's open to everyone. The conversation is very much fluid. It's introducing Dr Anand Ramakrishnan. He's a consultant psychiatrist for the NHS. Conversations today are around stress, anxiety, depression, and other types of mental illness. We don't deep dive into mental illness. It's more about how to look after and be mentally healthier. That's the idea. There are a few tips in there, and I wanted to say that we do talk about suicide as well. So there's your trigger warning. Hope you enjoy the conversation. All the chapter points are below, so if you do want to skip past anything or skip to anything, more than welcome to do so. Okay, see you on the other side.
Hi everyone, welcome to ChatGBP. Today we're going to talk about mental health, and we have a really good expert here in that field, Dr. Anand Ramakrishnan. Dr. Anand, please introduce yourself to the viewers.
Thank you for having me. Hello everyone. I am a consultant psychiatrist working in NHS, and I've been a consultant for more than 40 years. I started in India, then came over here. I had to undergo the training in this country, which I did, and then passed all the exams and everything, and joined back as a consultant in here, and then just carrying on.
Lovely.
Yeah.
That's fantastic. So you studied medicine in India, right?
Yes.
How was that compared to here? How was the culture from, especially when we talk about mental health, right? What was it like in India when you were studying and when you were thinking about specializing in mental health?
Actually, to be frank, the studying in this country and there, those days were almost similar. I wouldn't say same, but similar, because we don't have this kind of currently, there are a lot of, you get rest and you have separate rota and all kind of things now for the current students and trainees here.
Yeah.
Whereas we never had any of those things. We just work.
You just carried on.
Just that's all. Every day, every night. So we just go and sleep for some time and come back in the early morning and then go and do the on calls almost every other day, sort of. But with regard to mental health, there are quite a lot of difference, because this is the cultural difference between the Eastern and the Western world is quite, I can't say predominant, but it is quite visible that way. Because I tell you one example or a small story, I think probably that way.
Absolutely.
When I was working in India, one of my patients, his daughter was getting married, so he came and invited me. Doctor, you should come for, doctor, my daughter is getting married, and you should bless her, and she is so good and everything. And I said, of course, no problem. I will try my level best to come and attend. No, you don't have to come. I know that you are very, very busy, doctor. You don't have to come, but bless her, please.
What, from a distance? That's it.
Yeah. Because of the mental health. Because nobody wants to say that my psychiatrist is here. But if they are happy to say that my surgeon has come or my cardiologist is here, but they don't want a
still that stigma.
The stigma, yes,
is huge.
That was there, and that was. It is not as. I didn't make it up because it was real.
Yeah.
And that used to be there. Now things are better, obviously, over the years. I'm talking about 40, 50 years ago. So things are different now.
For sure.
It's better now. And even here, nowadays, the stigma is there. That is why we will probably later on, when we discuss certain illnesses itself, we can bring it up so that what is happening.
Yeah,
That's
absolutely,
yeah,
absolutely. So during your time
Yeah.
in this, obviously you've seen
Yeah.
many changes and
Yeah.
how cultures and countries have accepted mental health as something that needs to be taken seriously, right? It's not
Yeah.
just like, oh no, he's mad or she's mad, or just, put them to one side. It's being, thankfully, it's been treated with care and attention. I know the NHS is stretched. We're not going to go into that today, but we know that at least because it's at the forefront now, people can actually talk about it a bit more openly. Would you agree?
True, very, very true. I mean, luckily, I had opportunity to work in 3 different continents because I worked in India,
Yeah.
I worked for a short time in America,
Amazing.
and then this country. So, what I have noticed that basically human beings are almost the same, not much of a difference. How they express, how they talk about it, how they talk in groups are different. But otherwise, basically, one-to-one basis, people are not much different.
I agree.
Yeah.
I agree wholeheartedly, and I know my coaching business, the Grounded Balanced Performance, is geared towards a men's health. But in that respect, men, women, and other genders, they are
Yes.
mentally in the same boat. Would
Yeah.
you agree?
Yeah. I mean, that's what I'm saying. Basically, obviously, expressions are different. And again, that depends on your cultural and social aspects, and sometimes to a certain extent, environmental aspects also. Example where I work, that's the 5th largest borough in this country. There are 140 languages spoken in that space.
Amazing.
And only 45% of the population, sorry, not only, 45% of the population are non-white and non-English speaking.
Wow.
So that means, even in this country, there are quite a lot of difference. How things shape depends upon their experiences, depends upon their financial matters and social setup. So which is, quite can be different.
Has an impact, doesn't it? I think when you're looking from an outside perspective and you're looking at a demographic, there is cultural taboo for sure. Like I know in our culture, Asian culture, mental health is very much not really spoken about. I mean, they might speak to you because they know you're a psychiatrist. They might come and speak to me because they know I'm a coach, but very not in front of other people. It's not an open forum for anyone. Do you think the Western culture speaks more openly about it than the Eastern culture, or do you think there's no difference?
No, there is a significant difference even now, because the Western countries' advantage is that they are more open and they are more individual based. This is, for example, in the Southeast Asian culture and where we come from. It is more a family or a group or a society based. Here, because people are more individualistic, so they are more stronger and they are able to express their feelings openly, by and large, obviously, than the Eastern culture.
Nice, absolutely. I do see it, and I did work for a mental health charity for a while, and I saw that difference. I saw the fact that people were more comfortable, even in groups, talking about their mental health. But what I didn't see was the minority groups coming through.
Yeah, that is true. That is very true, because of the especially in the recent years, there are quite a lot of celebrities have come out,
Yeah.
isn't it, in supporting mental health because they are openly telling their own issues.
So,
Whereas this is happening in the Southeast Asian countries also. But how many people come out openly?
no,
So-
1.2 billion people, and hardly anyone comes out about
No,
mental health, right?
No, even the celebrities, they don't want
No.
to show themselves because if they think that if they show, they are openly saying that I have got a mental health problem, I got depression, or I got some other issues, they would be looked down upon by the other people, or they would lose their popularity. So that people are afraid.
Yeah, that's it. I feel like it, the way, I mean, this is leading to nurture versus nature, isn't it?
Yes,
That's
it
where
is.
it's going.
It is.
And I do feel in an Asian, in an Indian culture, let's say that, especially the way I was brought up,
Yeah.
you know, boys don't cry,
No.
boys need to man up,
Yeah.
boys don't be a girl. All of these sayings, not helpful.
They'll be called sissy.
Yeah, exactly. None of it's helpful, is it?
No.
Because when you're older, and like when I was growing up and going through my 20s and 30s, giving away my age now, it's one of those things when you're going through the motions and trying to understand
Yeah.
how your mental health is affecting you physically, because it does.
Yeah.
It was tricky periods of time where
Yes.
stress, anxiety, depression, those three things, I think they're common,
Yes.
and they've always been common. It's just they've not been labeled or easily
No.
identified. And I think, for example, in my late 20s, I was working in the chemical industry at the time, and one of my managers said, "Don't believe in stress, it's made up." And I just looked at him going, "Really?" And this guy was stressed almost all the time, but he doesn't believe in it
No.
because he didn't identify it.
No.
And this is he's a middle-aged white man from northeast of England, and he did not identify with it at all. And he said, that's the modern day back pain. So for me, I was flabbergasted, and I just thought, okay, right, I've got decisions to make now. So I made my decisions and moved forward and spoke to people who could understand.
Yeah.
Speak to that for a bit, for people who don't actually believe in any of this stuff.
Yeah, that is to a certain extent that is true for all men, isn't it? Because there's a masculine, thing that are a macho figure. They don't want to show that they can't cry, they can't feel bad, they can't get stressed out. But again, things are changing now. For example, for the students in schools and also in universities, there is a significant support out there to help children and students with this kind of difficulties and stress, because it has been well documented now that stress obviously has it is the basic issue for many students to not getting the grades, and it is closely related to other mental health problems or serious problems like depression and chronic anxiety and all sorts of difficulties. So they do get a lot of support when compared to probably 20 years ago. And even in professions, all the professional organizations have got separate wing. For example, our Royal College of Psychiatrists, where I am from, we have a separate support unit, psychiatric support unit, where people can anonymously phone, telephone, and they can get more information, and also extra support are also available.
Amazing.
So what I mean is that everywhere now, it is a very good recognition of having stress, and you hear a lot of stories, isn't it? in schools what happens. Unfortunately, in South Asian, especially India and other places, a lot of children commit suicide, which is much less here, but there is a significant amount because they have nowhere to talk to.
Yeah.
The teachers, you can't ask, like your supervisor, if they go to the teachers, they would immediately say that go and sit and study, don't waste your time.
Yeah.
So,
absolutely.
sorry. So that is a issue. So that is a sort of difference between these two the parts of the world, and between men and women. And again, it is more acceptable to show their emotion. So they cry, they get upset, they're not that much worried. Not worried in the sense they are not worried in showing their emotions.
Exactly.
Whereas men, they keep everything inside, and then unfortunately that ends up different issues later on, like there's more agitation, aggression, depression, and they are probably not the very good behavior in the society because they don't know how to control their emotions.
Yeah, because it's all that suppression, right? It's I always use the Coke bottle analogy.
Yeah.
You keep shaking it, but you don't open that lid.
No.
So there's nowhere to vent and no way to actually allow us to function the way we're supposed to function, which is, in balance, in harmony, mental, physical, emotional, spiritual. Those four things should be running in balance, in synergy, because then if one pillar decides to fall over, the other three pick it up, don't they?
Yeah, true.
And that's what happens. It happens. When we're grieving, that is a whole heap of stress, emotion that goes into it.
Yeah.
But you're more likely there, two pillars are falling over, but your physical and spiritual will pick that up.
Yeah.
When we talk about men's mental health specifically, and the whole bottling up of emotions, how have you coped through these years with any sort of mental strain? Let's put it that way.
Yeah,
because your job is demanding. I'm not going to sugarcoat it. It's demanding.
Yes, I'm not saying anything against that, because that is true, and because we are discussing other people's difficulties, which is emotional difficulties. So to a certain extent, it can affect you also.
Yeah.
To a certain extent. So that is why. That is what the experience come in, because you have been hearing this kind of stories and difficulties for years. Gradually, you develop your own coping mechanisms, how to not get sucked into their own problems. So there is a boundary there. So we are able to maintain that kind of boundaries. Whereas if it happens in your own family, you won't be able to maintain that boundary.
No, that's right.
So that kind of differences, and we will not go into the details, but you can have countertransference and transference and all kind of issues. The psychologists will explain that better than me.
Absolutely. Don't look at me.
So that kind of issues happen. And it is very clear, somebody who has started their career and somebody who are in the profession for a long time, you can see the difference, how they cope with it.
Yeah.
And rightly you said about the stress and how you manage it. And something more people are more getting used to now is what is reflection. So you sit down and reflect about what happened and how you managed it. And then when you do that, it is easy for you to make that difference. And what went wrong or what did not go wrong or what did well, all this kind of things you can make out better than when you are doing with another patient sitting with there for an hour or something, and then exchanging their difficulties and giving answers, and how you can and how they can cope with it.
For sure. So when you're talking about reflection and people sit down and do deep reflection, do you recommend that they write things down, or do you recommend that they draw things out? How do people do it, or what do you recommend?
Again, depends on you. In the sense, you means the people who do that, because some people are like, so for example, a few people make mind maps.
Mind maps are brilliant.
Yeah.
I love a mind map. So
yes.
That's
and certain people make pictures, caricatures on drawings. Some people write down. Some people don't do any of these things, but they think and they are able to get it through like a roller going over and over again. They can get it through their own mind. So it is a little bit your own practice and how you are comfortable with it.
So if somebody is going for a tough time at the moment, say if they are struggling with stress, they won't really know, will they? I mean, the first person who knows is the loved ones. They see whether you're stressed or anxious or depressed. And I'm talking about those three because those three are the most predominant day-to-day lifestyle mental demands. I just the only way I could put it, because those stress can come from work, it can come from family, it can come from anywhere, right? Anxiety can be picked up from however you've been nurtured along the way, and that's happened. And depression can hit anytime. Yes. Agreed?
Of course.
Anytime. So those three things. So if someone's struggling with any of those three, what do you say to those people out there? Go, look, what's the first step? Because men generally don't talk about these things.
No.
So who are they going to talk to?
Again, there's two things, because if you feel something is not right, ask your close friend, because you might find it a bit difficult to discuss with family, this one. So the best person is somebody, what we call as a confidant. So somebody who is next to you, whom you can discuss things. And try not to discuss it in group, especially within your friends. Because unfortunately what happens if there are half a dozen friends and you are telling them this one, 6 people have got 10 different opinions, which can make you more confused or upset, or probably feel bad about yourself, because they will say that, oh, so-and-so had a problem and they dealt with it, and this is that thing. So as belittling their problems, which is not very for you to get help from those kind of people. So one-to-one is the best to start with. And if that particular friend is not very good and unable to give you much support, then you have to find who is there. Either somebody in your family, your sister or brother or father or mother or anybody else. Or sometimes girlfriends are very good. If you have a very understanding girlfriend, they would be able to get it. So, or a partner. So you need to be careful about to choose the right person to get it. Otherwise, it can cause more harm than good.
Yeah, absolutely. And if someone feels like they can't go to any of those people, GP?
Yes. The GP is there, and of course the GP is the first person. And then GP will find somebody, because there are a lot of mental health practitioners within primary care nowadays, so they would be able to help you. If things are serious and the GP thinks, then he can make a referral to the mental health services also. And all these things are done in confidence, so there should not be any problem. So, unfortunately, professionals or probably who do well in their life are probably the worst in dealing with this kind of problems, because they have a feeling that they can manage everything. They are confident that they can look after themselves, they can control their emotions, they can control everything, because that's the way they are born and brought up, and probably they came up in their career. So that way. But as you earlier said, that it can happen to anybody, anytime, which is many people don't understand that. Then they find it very difficult to manage it. For example, we tell that doctors and nurses are the worst patients because they find it very difficult to manage because as a professional they are used to certain things, and once things don't go according to the way they wanted it or they decided it, they don't know what to do.
That's it.
Yeah.
And that is human nature, isn't it? I mean, a lot of these things are normally an effect of change of some sort, aren't they? We are designed for change. We are designed for change. And whenever I say that, I get three sets of responses. People go, "Oh yeah." People will go, "What is he talking about? I hate change." Or the other one of like, "If I say nothing, it'll go away." Right? Those things happen. So
that is what somebody said. What is constant in the whole world is change.
Exactly, because every in the yogic tradition, they say significant change happens every 3 hours.
Yeah,
it's true. You're not the same in the morning.
No.
By that time, it's lunchtime.
Yeah.
In the afternoon and the evening, we all behave differently. And night, there's a circadian rhythm.
Yeah.
So, if we're built for change and people are adverse to change, what's your advice to them?
They have to, first of all, if they think that they can manage it because the change they don't like the change and they want to change against the change, then they can make their life very miserable. Because I'm not saying that you should go with the flow, and I'm not saying that you should swim against the flow also. You can swim against the flow if you are capable of doing it. Like if you swim in the water in a river, when there is a flow, you have to have that kind of ability and strength to go across the flow of the water, isn't it? In a river, whereas swimming in a swimming pool is easier than in the river. So similarly, you have to know your strengths and weaknesses, and also try not to jump onto anything. I would suggest that take things slowly, sit down and think about how it is going to affect you, how it is going to affect the people around you, whether it is family or friends or whoever, and how you can, if you don't want this change and you want to have a change of job or change of something else, how are you manage that change? Because if you are moving house, if you are moving relationships, if you are moving anything, that is a stressful thing for some time.
It is. One of the most stressful things you can do is buy a house.
That's right.
And people do it all the time.
Yeah.
And they tell you how stressed they are.
Yeah, it is. So that way, it is difficult. So best thing is to, obviously we don't have answers to everything because we don't know. So try to get some help. Get help from your friend or your managers or somebody who knows about more, and have a chat with them. And the worst you can do is if people talk about in a group or in a discussion or a meeting, standing up and shouting because there is a change, which is the worst, because you are shooting yourself in the foot and you'll never get through that, and unfortunately you become more stressed and more upset.
That's it. That is exactly it. That's the difference between reacting and responding.
That's right. Yes.
I normally say the difference between reacting and responding is about 10 seconds. Agree?
Yeah.
Because if you're reacting, you've not really seen the full scenario.
Yeah.
If you step back and give yourself that time, that space to breathe, you can see a bit more unfolding, and then you can respond accordingly.
Yeah.
And I think that's how we should be with change. But we're all human.
Absolutely, that's right. So if you think that when it happens, look, I can't take it anymore, I think it is absolutely useless.
Mm.
There's nothing prevents you from, you excuse yourself and get out from there. Go somewhere else, think, and understand the whole why the change is happening, and try to understand more about it. Ask people, read if you need to, and then I'm sure you'll be better knowledgeable and better accepting the change. And if something different can be done, well, you have an opportunity to talk about it.
Yeah.
Not shouting about it, but discuss.
Yeah, absolutely. So, from that, what do you have any tips for people who are struggling with stress at the moment? We'll go through one by one. If you have any tips for stress, tips for anxiety, tips for depression, anything?
No, tips of stress, as I said earlier, discuss, talk to people. That is the most important way, the stress, because the way people deal with the stress is, for example, stress, if you deal with stress and I deal with stress and somebody else's are different. So we need to know which is good for you and what causes stress. For example, if you are a student for the exam, little bit of stress is useful for you. If you have no stress, possibly you may not do well. So a little bit of stress prepares you for the exam, and because you have to do things in the right, such a short time you have to do things. Or for example, if you have in a relationship, or you're going to get married, or you want to you have to move jobs, or you want to travel for a backpacking or whatever, you need to write it down. Then what I tell people is that to cut into small pieces. So each big portion of a job. For example, if you have to take 5 exams in one go, in one go in the sense in a week or 2 weeks time, slices into different pieces, and then because you can manage slices better than the whole.
Absolutely.
It is not, I'm not making any big theory here.
No.
Because everybody knows about it.
Yeah.
So that way, to understand things, then, as I said earlier, get help.
Yeah.
Talk to people. And most important thing is, if it has happened to you before, learn from it. And because it's not only one thing. If the stress is something which you're never going to done with it.
No.
It is going to happen again and again and again and again. So how you managed last time? If you managed it badly, what did I do wrong at that time? How I couldn't do it well? Talk to others and tell them that this is what I did. What do you think?
Yeah.
So,
because there's always someone who you think is coping with that stress better.
Absolutely.
So if you can engage with them,
yes,
and have that conversation, that's brilliant. If you can't, then it's time to model yourself in that way. Would you agree?
Yeah, absolutely. And certain things are important is that I had a friend. He has been, for the exam, he has been drinking a lot of cups of coffee, and he ended up in A&E because of palpitations and just problems.
Yeah.
Because that is bad. One thing is good is you need to don't spend the whole time reading or going through. I'm just talking about the stress related to the exams and everything. And take some time out and probably you can write down, like you said, about 3 hours. Things change every day. You have a timetable. You write down what you can do from morning to evening. So how many hours you study, how many hours you go for a walk, talk to people, watch not probably a whole movie, but at least snippets. You watch television and everything, talk to people. You need to do it in a very structured manner, which would help you.
Yeah.
So I still remember when I did my membership exam. Before the exam, I previously I was not very good in going to gym. Although I had a membership, but I never went there.
That's a lot of people. Don't worry about it.
Every day I'm busy. I couldn't. Okay, but this one I took 2 weeks leave from the work. Every day, morning and evening, I went to the gym, and came back and sat and read and everything. Discussed with my colleagues, and that was good. No problem. And the exam, it was much easier. Although I obviously I was stressed out, but nothing, and I passed. I'm not saying everybody the same thing can happen, but what I meant to say that because at that time I made it a structured manner. I tried to do it properly. I succeeded. If I did continue my previous way of dealing with it, I would not have. So
you learned.
I learned.
You learned.
Yeah.
And that's good. That's an amazing example as well, because you're what you do. You understand what cortisol does.
Yes.
Right.
Yeah.
Explain what that is to people.
There's this stress. Actually, what happens is that the body, there is a hormone, what is a cortisol. Again, that cortisol response or cortisol secretion depends upon the circadian rhythm. And certain times of the day it is good, and certain times of the day it doesn't happen. And again, when you are stressed out, your adrenaline, of course, when you see that suddenly if I go and suddenly this is a very habit, especially children, where they make somebody frightened, isn't it? Boo, like that, or
that's it.
Then people get frightened, and then what happens when you're frightened? And then you feel the whole body becomes quite warm. You become warm, and probably your hands and legs probably shiver a little bit, shake, because that is the adrenal reaction which comes to you. So a little bit stress it happens, but if it's severe stress, what happens? For example, if there is a cat, some children, or some people are very, cruel to cats, or even let's not a human being. There is two animals. The one animal, come and frighten the other one. It goes into a corner, and the corner just then all they try to attack the intruder and attack the other animal. Then they find that it is not going to happen because that is a big one. For example, leopard and deer, and then it becomes completely because they crumble completely. Because they are unable to, because that is the situation. That's the worst situation you can ever be in the stress. So never ever get into that state, because then it is very difficult to get out from that stage. So that is what the hormonal reaction to how you do and how you face things, and the flight or fright reaction which is happening. So that happens to all of us. If somebody says never happened to them, I don't believe them.
I don't believe them. No.
Sometime in your life, it can happen. I heard about Lyndon Johnson, the American president, when he was young, about 7 years or 8 years or something. He was in a very woodlands. He was standing there near a river. And somebody went and asked him, why you are standing there? I'm not frightened. I'm not afraid to stand here alone in the evening. He said, what is afraid? What does that mean? So I don't know if it's true or not, but what I meant to say that if you are not afraid, if it is not being the way you are born and brought up, it is very difficult for you to understand that.
That's it.
So
that's it, and it again comes back to nature versus nurture, doesn't it?
Yeah.
Again, and that will be a recurring theme for sure. Of this talk. So, I mean, that's great. Thank you for that explanation. It's fantastic. I mean, flight or fright or flight. It's so easy to say, isn't it? Is one of those things that we experience, or freeze, right? Because they're things. I mean, that is our amygdala working overdrive. And the cortisol, I'm glad you said it. It is with our circadian rhythm. It's designed to wake us up in the morning and get us out of bed.
Yes.
That's it. That's the purpose. But obviously, when we have overwhelm, and that's when these other things happen. And I think that's a good place to be. Move on to, because I think the things that we've talked about, stress, anxiety, and depression, overwhelm is the precipice of it. Would you agree?
Mm-hmm.
Yeah,
sure.
So, when you talk to your patients or you're talking to people in general, what do you say to them about overwhelm and what to look out for? What signs?
I mean, because as you know, what happens in stress. For example, we're talking about stress, isn't it? So stress. What can happen is that many times it depends upon the situation. The stress can happen in various ways. For example, your stage fright, the social anxiety. When you go there and then you are unable to speak anything, you knew everything. Similarly, in the exams, people have learned everything. They know from A to Z completely top notch. But in the exam, when you get the pen and paper, but nowadays I don't think only in the typewriter, whatever.
Yeah.
People find it difficult. They can't remember anything. It doesn't come. So what happens is that your mouth becomes dry, you become hot, you start shaking, and sometimes you may feel that a bit what they call it, the butterfly in the tummy, and heart beat fast, and all these things can happen, and you're breathing fast because all this can make it much more worse. So if you ever start feeling these kind of things when you have feeling with any adversity, that is the time you have to think about whether are you having the real stress reaction and how you can deal with it. So initially, obviously, all the symptoms will not be there. Few things which will come. The usual ones are that they're getting dryness, you can't speak anything, there is no complete saliva, completely dries out, and all the issues come. So that is one thing. Then you need to talk to people, try to get the right kind of help, and what we have discussed before, you need to get into those kind of different strategies, and there is no single strategy work for everybody, and there is no single strategy work for same person every time.
Okay, so what strategy generally works though? There are breathing techniques people can do, right?
Yes, there are relaxation techniques.
Okay. So
which is the breathing. Obviously, I can tell you very, very simple. There are different kinds of breathing techniques. If you look at if you Google it, you'll get at least about 200 or more different kinds of breathing techniques. And what I can suggest is that very simple technique I tell people is to sit down somewhere comfortably, like here, sit down, and don't cross your legs, uncross your legs, keep your hands on your knees, and straight. Don't lie down. I mean, you can lie down also. Yes, you can lie down, but only thing is, don't lie down on it. But if you are lying down, you have to lie down flat, not on the side. Then take a deep breath. Take a deep breath. How much you can do? Take it maximum. Then hold it. Then breathe out slowly. You should not even know that you are breathing out. Slowly. See,
nice.
I took so much time to breathe out.
Yeah.
So that is what you need to do. And pardon me, don't expect any miracles. Nothing will change in a day or two. Many people think that, yes, I did what you said, but no, it is not for me. How many times you did? Oh, I did 2-3 times. But that is not the you have to do it at least 3 times a day for about 15-20 minutes. And you do it for a couple of weeks, then you slowly see the difference. What you see is your when you do that, initially your body relaxes. You can just keep on doing it. You can see that the hands go limp, your legs go limp, the whole muscles go limp, and then you can see that your breathing, your heartbeat, and your emotions also, the stress gradually comes down.
Nice.
So if you can do that, this is a very simple exercise anybody can do, whether you are 90 years old or you are 19 years old. So
it's for anyone.
Anyone.
This is good.
Yeah.
This is very good. I like that. That's very good. Very helpful. Like you say, you Google breathing techniques.
Yeah.
I think that is enough to cause overwhelm when you get 200. Which one am I going to do? And you're out. You're done. So I think one thing I was taught a long time ago was breathing from your stomach.
Yeah.
Making sure your stomach is loose.
Yes.
And just allow, because low and slow is better than high and fast.
Yeah.
And like you say, when we're in high pressure situations, the breathing goes from here to here.
Yeah.
Very quickly, and sometimes it feels like it's here.
Yeah.
Hence the saying, "In it up to my neck."
Yeah.
So we all have these sayings, but we don't really sit down and think about it that much. Okay, so I think if we talk a little bit about anxiety as well, so I think the same things are applicable, aren't they? You talk to somebody and are confident and are able to articulate what's going on, because there has to be some sort of source to that anxiety.
Yes.
Would you agree?
Yes. So usually precipitated by something. The anxiety can be precipitated. For example, there's generalized anxiety which can happen anytime. Anything, and whatever going on in the house, or there's a little bit of sound, then you get the starting reflex, all sorts of things which can happen. And the social reflexes are there where, social stresses are, social anxiety is there where you go into the podium to speak and then nothing happens. Or you go in a public place and for doing something and you are unable to do which you have been doing or you have done many times. So those kind of anxieties are there. And then one-to-one basis, for example, in the situations like examinations or, for example, if you want to talk to your girlfriend, sometimes, people, or boyfriend, either both ways, people find it very difficult. They don't want, they want to say something, they are completely prepared, you go there, what happens? Nothing comes out, or comes out something which is probably, you should not have said that. Yeah. So those kind of things do happen, isn't it? Yeah. So those are the sort of, which is again anxiety related. And obviously anxiety is, and even in your, in your school or in your class, when you're discussing with others or discussing with a teacher or discussing with your professor or whoever, all these things can happen. And again, performance, which is for those people who are in the, whether you dance or you sing or you do anything else, the same issues can happen.
Yeah, of course they do. And I think anxieties, I always called them supercharged worries, because stress happens in the present, doesn't it? It happens, you feel that, and it happens right now. Anxiety is something that's happening in the future, or you perceive it happening in the future, but you're experiencing all the madness right now, all the anxious, the worry, everything that goes with it, and then you bring it from the future into your present, and then all the stress responses come out. Have you got any tips for people with who suffer with or struggling with anxiety?
Any?
Two things which probably we didn't discuss is the panics before going to that, because
Sure.
anxiety, when you talk about anxiety, panic is a very serious situation, because it is not something easy, something small, something silly, but it can be quite difficult, because panic is something which is suddenly you think that you're going to die. That's a sort of feeling that's serious. People think that the what they call it a sort of foreboding thoughts, that is something impending danger, as if you are going to die, you're going to jump down, somebody is going to push you out for the train or the plane. And sometimes the agoraphobia, where going out, and also the claustrophobia, all these kind of phobias can do something with it. So that is quite serious.
Yeah.
That needs treatment, either with medications or with talking therapy, because you have to do that, because that will not go away just like that.
No.
So you have to be serious about it. And other second point, which probably we didn't discuss, is again sleep, which is common, which is goes with this anxiety and stress, and all these things can affect the sleep, which is one of the common problems all of us face.
Yeah.
One time or other in our life, we do face that.
Agreed.
So that way, how the sleep, how are you going to get the right kind of sleep? And what is the right kind of sleep? Again, that changes from person to person. It depends on what you do. You go for these shift workers, and then it is quite different for them.
Yeah.
So that is also need to think about. I will not go into the details there, because then we need probably a few hours for that.
I agree, and I think those things are you've ticked off a few things there, because when you're talking about phobias, and they are part of anxiety and anxious behavior, as it were, and your talking therapies really do help get people across the line, however they want to see the future. Whether they want to tune them down or turn them off completely.
Yes.
It's possible, isn't it?
Yeah.
It's up to that individual of how far they want to go down that road. Yeah. Let's get into a bit of depression. I should say it in a light-hearted way. It's a very important topic, because obviously, there's low mood and then there's depression. Would you agree?
Yes. Low mood is normal. Little bit normal, in the sense, for example, you didn't get your lottery. You get upset. or the relationship broke, and you feel upset. Very seldom people say, "Hi, it is done." No, this is good. No, people don't say that. It's just like, so that kind of things which are normal, and that helps people to a certain extent, because that kind of time when you have a little of introspection, when you can think about what should I have done, what is better, why it happened, why it's me. But then when it becomes an illness, which is depression, which is more sustained, and it is more severe, and it lasts longer. So it is usually lasts more than about a couple of weeks or more than that. That affects your whole function, your decision making, your understanding, you're able to enjoy things, you're sleeping, you're eating, your interaction with other people, interaction with your partner, all these things get affected. So that is depression. And that depression again can be dealt with talking therapy in the early phases, obviously, or you can have medications, but obviously medication does not suit everybody. And sometimes, you need both. You need both medication and talking therapy, which can go hand in hand.
Absolutely. So the first step for somebody struggling with that sort of depression.
Yeah. So again, to acknowledge and understand that, you are finding it difficult. That's the more important. Don't try to fight with it, because if you try to fight with this initially, it can make you feel worse, because your capability suffers, because you are not the best in terms of your understanding and how much you can do things. And usually you are a very, very cohesive and very active person, but you don't know why you can't you can't do things. You have no clue. And again, the danger of severe depression is that it can lead to see that, what's the point in carrying on life, and let me do something, or let me finish my life, which is, people have suicidal thoughts, which are fairly common with that kind of situations. Not
Sure.
early depression, but the thing.
Yeah.
So they have to take it seriously.
Indeed.
And when you have depression, first, as I said, think about it, try to reflect on what happened and why it is happening. If you are able to find an answer, try. You deal with it. Or you again discuss with your friends or family or whoever you trust. Because it is important to have a trustworthy person next to you to deal with this kind of issues, because that is the best you can ever have. And
Agreed.
so that way, if you have it, so that you can have a good life.
Yeah.
And then the most of the depression would go away initially, obviously. When I'm talking about the very, very, very first few days, when you think that your sleep is not the same as before, you are feeling very weird and things are not right, I can't concentrate, I can't laugh, and why is nothing wrong with me, why I am like this? Then you try to say when and why and how it started, then try to deal with it. If you can't find an answer, definitely go for help, because that is the best to do. Because then don't try to meddle with it or fight with it, which can, and as you know, it takes a longer period of time. It goes into a few months or something. It can cause problems.
Absolutely. I think it was Albert Einstein who said, you can't fix the same mind with the same mind.
Yeah.
You need someone else to
That's
come in. So, like you said, almost about everything is talk to somebody.
Yes.
Is reach out and talk to, and do not bottle it up.
No.
It's one of the worst things we can do, especially as men. We like to just put a lid on it, brush it under the carpet, and it just doesn't work, does it? It's just not the way forward.
That's true. When you talk about the men, one of the most important bit is don't get into habits, or you can have an extra beer or extra drink, and which is unfortunately happening.
Happens.
I'm not blaming anybody.
No.
Of course, most of the people enjoy a drink or two.
Sure.
But that never go beyond that, because that is not going to help solve the situation. It will make it worse.
Yeah. It almost always hinders progress.
Yes. And that's the same with youngsters going for the drugs, and not only youngsters now, actually older people also does that. So it can happen to anyone. So we need to be careful that you have to sort these things out. Unfortunately, alcohol or drugs or anything will never solve these problems.
Yeah, I 100% agree with you. So that neatly gets us to, what can the NHS offer?
NHS, the first point of contact is the GP. So you go to a GP if you think that whatever we discussed now, if you think that you understand that something is not right with me, not physically, obviously, and so you can go to the GP, and GP is the majority of GP, probably not 100%, but 99 or 96% of the GPs are good and to help people, because they are trained to do that. And if they think that you need further help, they would make a referral to the mental health services. Depends upon what part of your country you are. There are waiting list and issues there, and again depends upon what kind of problem you have, and whether it is you are a child or whether you are an older person or you are a youngster. So those kind of differences are there, but by and large, you do get help. And there are people, and then before, if the GP thinks that you don't need medication, I mean, usually GPs themselves start medication, and if that doesn't work, then only they'll send you to the mental health services, that is otherwise called secondary services. The primary services are the first stay of everything, and they can refer you for these talking therapies, because all the boroughs, all the counties, they have talking therapy units, and they don't have much waiting list, and by and large, you get a fairly fast response, and that they should be able to, but don't feel bad or don't feel wrong in approaching them. And people, you should not feel that that is not going to help me, that is not for me, but please try. And try for a consistent period of time. Don't do that, I try for a week and then it's not working for me, pardon me. It will not, because psychological therapies take more time. Medication also, mental health medications will not work immediately, because what it is not, if you take the medication, what happens? If you take the tablet, it goes into your stomach and gets absorbed into your system, and then gets into the body and gets into the brain, and then it has to get into the brain and then interact with the chemicals within the brain, or the neurotransmitters and receptors, and then that should make the changes, which is quite different from you take a tablet for paracetamol and then your temperature goes down, or a headache goes down. No,
Yeah, absolutely.
So I usually tell people that it takes about 2 to 4 weeks. So if you think that you take a medication and you don't feel better, that is not going to help. So that is why, please seek help as early as possible rather than later.
That's brilliant. Thank you for that. That is amazing. So I'm glad we do have the NHS.
Of course,
it's fantastic, and you guys work incredibly hard. I've seen it. I've got plenty of doctor and nurse friends. I hear about it. It is a demanding role, especially now, and still there's help out there, which is fantastic.
Yeah.
Let's talk a little bit about how the body contributes to the mental health.
Yeah.
So, and more specifically, diet, nutrition, right? Because neurotransmitters are formed where?
Yeah. Okay, so there are two things when you talk about the physical health. One is about nutrition, as you rightly said, and second one is exercise, because there is plenty of evidence. The research has shown that for all mental health issues, you need to have good physical health. So that means if you have good physical health, better mental health. Both are quite they go together and quite intermingled. So those days are gone where the people think that I can sit down and then if I'm good, I should be all right. I can read or I can understand and then I should be okay, or take some tablets, I should be okay. No, you have to take the tablets, yes, if you have that kind of illnesses, but you should take exercise. Exercise, I don't mean you have to go to gym every day. If you can, fine, but at least exercise like walking or any other exercises you can do in your own home or outside or with other people. If it is mental health issues, I would suggest please go with other people, because it is good that you talk to people not about your illness, but you talk about other things, and then you walk. It will help you. And in terms of nutrition, nutritional health is very important, because the gut bacteria and mostly there is a lot of evidence to say that a lot of things are starting from stomach now, following your gut, than in the brain, because there is a gut-brain connection there. which has been coming at more and more prominent now. So it is important that you have regular diet, balanced diet if you can, and all this fruits and vegetables and meat, but be careful about the meat, and you have to, because again, the cholesterol and everything, which is hypercholesterolemia or high cholesterol situation can happen, and if you eat a lot of meat. And you have to be careful about eating. First of all, don't eat too much, obviously, everybody knows that, and space it out. And also, again, try to do it in a structured manner, because you have, as at the morning, noon and evening, if you take it, if you have good breakfast, and all these different kinds of fancy diet, there is no consistent evidence to say that is going to help you, but that is causing you either you have to pay for it, or you have to do other things, very strict dieting. But without anything, you can just manage your diet, everyday diet, and you can have a very, very balanced diet, and your body will respond very much better to that. So then you will feel energetic, you will be happy, you will be able to understand and consider and to take it in clearly, rather than getting muddled and getting sort of people say that like a brain fog and those kind of things. You don't have to. So try to do it regularly, and again, your regularity is different from the neighbor. So don't just think that is about the same, but make sure that you eat correctly, and keep an eye on your weight. Especially depends upon what age you are. In a younger age, obviously you are growing. You need to eat more. If you're older, you have to be a bit more careful, and you look at, and again, depends whether you are any blood pressure. When you're older, you have got problem with the blood pressure or diabetes and all sorts of other issues also. So if you have a I don't know whether you wanted me to set up about this, or because I didn't want to go into details, and I didn't want to go into.
No, you don't have to. We don't have to dig into that today. We can do that another session where we can specialize. That's no problem. But I'm glad you touched on all of those things, because it is about what we eat and how we exercise. I think a personal trainer of mine said you can't out exercise a bad diet.
No.
And somebody who I knew quite well in the mental health arena said, "You can't. Your brain needs good food to function. It's like giving a diesel engine petrol and vice versa. If it doesn't have the right food, it ain't going to perform."
No.
So, and that wasn't just for a day to day, but if you're studying for exams and you've got you're using your brain a lot, then there are certain foods that you can eat.
That's right.
And they'll get higher brain function. And if you're working in a very strategic, tactical way, you can do certain things to, it's stuff like that. And we don't have time today to go into all of that, but I'm glad you touched on all of those things. Okay. We're going to start landing the plane, as it were. So talk to me about your your health, your holistic health, the way you look after yourself. And we touched on it before, grounded, balanced performance is about the 4 pillars. So, how do you look after your mental health?
I mean, just as... I don't say that should be for everyone, and I don't mean that way.
No, this is just you.
Just me.
Yeah. This is just you.
I have a regular diet, and I don't eat more. That does not mean that if there is something nice, I'll take it once in a while, because at the end of the day, if you know what you're doing, it is okay. It is not going to affect you badly. So you have a regular diet. And regular, of course, one thing I'm not as good as is exercise. I should do that more. I don't want to lie.
So that's your physical health bit.
Yes, I don't want to lie to our audience. But otherwise, if that is regular, I mean, because it is a winter, this is a cold and the
Sure.
weather. But definitely, I will be doing that regularly because that is true. And even at work, we are 2-3 people. We regularly, if it is not raining, at lunchtime we go for a walk.
Nice.
15 minutes is not that much. We don't have that much time. So
No,
15
no.
minutes, and there is a uphill there. We go uphill and come back downhill two rounds. That is enough for that time being.
But that is enough, isn't it?
Yeah.
15 minutes
Yeah.
of doing, getting a little bit out of breath and increasing your heart rate.
Yeah, it's good. So
It's good.
I do that, and then I find some time to watch television, and we discuss things at home, read, talk to friends. Talk to relatives. So it's just like anybody, just as normal things, and go for work and come back. And at work also, I don't get stressed now because there's no point in get stressed because we know how the NHS work. Excuse me, and definitely there are problems.
Sure.
If I say that everything is honky dory, I am really lying to you people. No, I'm not. So things are there, but we deal with it. And we just get on with it. That's all I do. I'm not saying that I'm doing extremely well, but I think I'm all right. So I don't feel anything bad. So that means I feel I think it's okay. I sleep fairly well, and I eat fairly well, and I do things. So I think that is what I do.
Perfect. And then how about the other two? Because we talk about heart and body already. So, mind and body already. We've talked about that.
Yeah.
What about the emotional side and the spiritual side? Do you do anything on that front?
Yeah, spiritual side, obviously, there are, spiritual is not religion alone.
Agreed.
People say that immediately spiritual means religion. No, it's not religion. I mean, religion probably plays a part in it because you are born and brought up with it. So you've got values and beliefs embedded in you. So that is there. And then you, dealing with people, that is a kind of spirituality in the sense, if you can improve their spiritual life. And part of my job itself, I talk about it sometimes to the patients because there is issues about detachment and how you interpersonal relationship, how you can maintain, how you can talk to, I'm not saying God, but talk to somebody whom you trust in it and you believe in it, and you can improve that situations. So that is all part of the spiritualism.
Sure.
So which I practice in my regular practice also. I talk to people, and I do myself. And then emotional, that is satisfaction because they're within the family. You got wife, you got children, you got grandchildren, so they are all part of the emotional strength you have. Yeah.
Nice. Lovely. Absolutely fantastic. Excellent. Cool. Well, yeah, I think we can wrap up about there, can't we? That's a fantastic discussion we've had about men's mental health and mental health in general. Was there anything else you wanted to add before we said tie this up in a nice little bow?
Yeah. Now, I just wanted to tell people that try to understand what's going on with you. Try to understand what's going on in your family. And if you cannot manage it yourself, get help.
Perfect.
So that's all I can say.
I think that is absolutely perfect. Yeah, on that note, we can call it a wrap. So everybody, thank you very much for listening. We've been in the presence of Dr Anand Ramakrishnan, psychiatrist for the NHS and consultant. Right? Yeah, fantastic. So thank you very much and see you in the next episode. Hey everyone, thank you very much for joining us today. I hope you enjoyed our conversation with Dr Anand Ramakrishnan, a consultant psychiatrist for the NHS. yeah, we know the NHS is stretched and there are still great people working there. So if you need help, please reach out. I've put some extra contacts below so that if you do need it immediately, reach out to these wonderful people who can help you. All right, take care. Have a lovely day.